Exosomes. What are they? What do we use them for? You hear a lot about them. It's actually the latest and the greatest in the stem cell therapy arena. Well, exosomes used to be endosomes, and then they were released from the stem cell. That's not real helpful, is it? Well, I'll describe it to you. When we do stem cell therapy, we're not actually giving you a cell that's going to live in your body and become you. What we're doing is we're giving you a cell that's going to find your stem cells in your body that are kind of pooped out, and they're going to give them a refueling or a battery pack or an energy booster. Okay, now how do they do this? Well, we found out in studies that if you take certain primates and you damage certain tissues, say brain cells, and the brain stem cells are incapable of regenerating that tissue because they're already pooped out, I give a foreign stem cell into that primate and we radio label it. What we find out is that that stem cell finds your stem cell that's pooped out and takes a microprobe, introduces that microprobe into the pooped out stem cell and delivers it mitochondria and proteins and endosomes and exosomal protein materials, which are cytokines and factors and amazing things. So what do? Remember what mitochondria are. Mitochondria are the powerhouse to the cell. Stem cells that I transplant into you give your stem cells batteries. It's as simple as that. And an exosome are just the inside parts of what your stem cell or what the donor stem cell gives to your stem cell. Hopefully that was clear. I'll try it again, an even more simplistic explanation. When I give you a stem cell from another individual, a live stem cell will find your stem cell that is incapable of continuing the regenerative process, and it will give them the proteins necessary to have them start up again to regenerate you. And after a certain period of time, the stem cells that I give you just die off. That process takes a couple of weeks to occur. Some things happen instantaneously, but most of it happens weeks to months later. When we give exosome, there are no live products in there. The actual stem cells themselves are broken. I call slang for exosome stem cell juice because it's stem cells from a donor that are broken, and all the important stuff, the stem cell juice, is utilized in a free form and injected, and for some reason, I actually get a response almost instantaneously. We get pain relief right away. It's amazing stuff. You can get it from cord blood, you can get it from amnion tissue, you can get it from connective tissue from within the placenta itself. It's an amazing new area and an amazing new field. We'd love to expose you to more of this. Stay tuned. Better yet, come visit the N.I.C.E Clinic.